My name is Dr. Stephanie Saucier. I'm a board-certified cardiologist and lipid specialist, and today we're going to be talking about aortic stenosis. So let's dive in. One quick favor to ask. My goal is to provide quality cardiac education to those who need it most, whether that be a healthcare provider, a student, patient, or a family member who needs to understand cardiovascular health, the research, and all of these important topics. So please hit the subscribe button. I would really appreciate it. And it'll help us get the information into the eyes and to the viewers of those who really need to know this information and those who would benefit from it most. So I hope you enjoy the video. Let's talk about the signs and symptoms of aortic stenosis. The signs and symptoms of aortic stenosis most of the time involve shortness of breath. It can involve chest pain, passing out, or feelings that are consistent with heart failure, such as swelling in the feet or in the body, and as well as fatigue with exertion. So those are some of the most common symptoms of aortic stenosis. The most important question is, what is aortic stenosis? Well, aortic stenosis is when your aortic valve doesn't allow blood to flow as freely as it should from the left ventricle into your aorta. So the aortic valve sits between the left ventricle and the aorta. Blood is supposed to move from the left ventricle through the aortic valve, through the aorta to the rest of your body and supply blood that's filled with oxygen to all of the organs and the muscles that you need. And so when the aortic valve becomes too tight or it's not opening the way it should, we call that aortic stenosis. What causes aortic stenosis? Well, that answer gets a little bit more complex. It can be caused by aging and calcification of the aortic valve, which is one of the most common ways that the aortic valve becomes stenosed. It can also become stenosed if you've had something like rheumatic heart disease at a younger age that can damage the valve itself. Aortic stenosis can also be caused if you were born with something like a bicuspid aortic valve, which is a valve with 2 leaflets instead of 3 leaflets. That is also predisposed to development of aortic stenosis or narrowing of the aortic valve earlier in life. Those are some of the most common ways that the aortic valve gets stenosed or tight. How is aortic stenosis diagnosed? Well, I have a really good answer for you. It's pretty simple. It's non-invasive for the most part, and it involves an echocardiogram. An echocardiogram is an ultrasound of the heart where we use sound waves to show the heart, and we're able to look at the valve itself. We're also able to Doppler to see what the valve looks like, how much it's opening, and how much blood is getting through the aortic valve. So we use an echocardiogram to actually determine the measurement of the opening of the aortic valve. And we grade it as either mild, moderate, or severe aortic stenosis. People may ask, well, I have aortic stenosis, so what now? What are the treatment options? That's a question I get asked a lot. Now, aortic stenosis, if it's mild or moderate, we typically watch it. We monitor the aortic stenosis, and then when it becomes severe, it's very important that we treat it aggressively, and this often includes either surgery or a procedure called a TAVR. And so we replace that aortic valve. That is the definitive treatment for severe aortic stenosis. Now, in years past, we used to be doing open heart surgery and replacing the valve. And in the more recent years, we have a TAVR or a transcatheter aortic valve replacement, where we actually replace the valve through either the groin or the neck, depending on your anatomy and your other risk factors. So we have to replace the valve. That's how we treat it. But now there are more options on the how we replace the valve. I have aortic stenosis. What's the treatment? And that's a question I get asked a lot. So we do use medications to make you feel better. However, when you have aortic stenosis that's severe, ultimately we have to replace the valve. Now, this can be done either with open heart surgery with a surgical aortic valve replacement, or with a transcatheter aortic valve replacement or a TAVR. Now, these are 2 different techniques that we use to replace that aortic valve, and your doctors and your surgeons will determine which one is right for you, whether it be a full surgery or whether it be something that we can do through either the leg or the neck more peripherally. So there's a few different options, but ultimately the valve has to be fixed and replaced. Can I prevent aortic stenosis? Unfortunately, no. You really can't prevent it. There's nothing you can change in your diet or exercise that's going to prevent aortic stenosis from forming or happening over time. So it's important that your doctors are listening to your heart, trying to identify early signs of aortic stenosis. And then if you are diagnosed with mild or moderate aortic stenosis, monitoring the progression of your valve disease until it's time that we fix it. If you want to learn more, then click the link below to go to our free heart health guide.